Cost from an accreditation process has to be taken into consideration what it would cost a program not to be accredited. To be recognized as a leader in a particular area is certainly worth the price of accreditation. With respect to outliers, issues within the laboratory that might lead to things like external investigations would certainly make an accreditation process more than pay for itself.
All it would take is that one audit process come in the hospital and you have to have a big penalty or something like that. So, you know, the best defense is to be ahead of the game, I think. And part of doing ACE is to find out where you do have a problem. If there's a problem in your documentation, it's how to make it better. Because after all, when the RAC inspectors come, when the other organizations come and want to look at your charts, all that's really there is what's written in the chart. And if what's written in the chart is incomplete or it's not correct, then you're going to be in trouble. So I guess you could almost think about this as the cost is justified by the end result. It's been kind of a unifying factor within our cath lab to say, here's a goal, this is what we want to go for, and everybody really came together to reach the goal.
You know, this is an insurance policy in some respect, you know, against the many things we need to be cautious about. And it has to do with our documentation, again, our quality. So it's a defensive move, much like life insurance or malpractice insurance is, that offers you protection and allows you to do the things you need to do to make sure you will pass any kind of scrutiny, whether that's a RAC auditor, whether that's a medical malpractice claim. Again, it's a move that allows you to improve your quality and makes you less susceptible or liable to any of those kinds of things.
Well, there's a lot of, I think, unseen benefits with ACE certification that are really pretty hard to quantitate. But I think you increase efficiency in your cath lab, you increase throughput by standardizing a lot of procedures. I think there's probably a decrease in problems getting authorization for patients to undergo catheterization. And overall, there's marketing opportunities because of the kind of distinction that you get from having gone through that process and having a third party come in and say, yes, this lab is delivering the highest quality of care that it can.